March is being observed as Colorectal Cancer Awareness Month. This is because this type of cancer that is quite common in the Jamaican population can be prevented if detected early. Shamala Pullen tells us more in the health report.
Colorectal cancer, colon cancer, is the third most common cancer in Jamaica. Head of surgery at the University Hospital of the West Indies, Professor Joseph Plummer, says roughly 500 to 600 new cases are seen yearly.
I think it's important to note that once a patient is diagnosed, you really keep that patient coming back to the clinic for a minimum of 5 years. Only then, after they have had their treatment and they're disease-free at 5 years, do we say that they are cured. And so with the frequency of visits become less. So this is why we can't really talk about, because you may be recording the same person on more than one occasion in that year.
Professor Plummer says the cancer affects both sexes. However, studies show that young people are increasingly being diagnosed with the condition.
Colorectal cancer, maybe in about 15 up to 20%, it's directly related to the gene pool. Your family has a history of colorectal cancer, sometimes not directly colorectal, sometimes breast, sometimes endometrial cancer, but that abnormal or bad genes pass from one generation to the other. There are other important risk factors, however. Diet. So we do think that a diet that is high in processed food, high in fat content, lacking in fresh fruits and vegetables puts patients at risk. Not just diet, but also lifestyle.
The symptoms include blood in the stool, change in bowel habits, abdominal pain, and change in appetite. Professor Plummer is stressing the need for early screening and that persons should not be discouraged by the process.
A patient with stage 1 colorectal cancer, 5-year life expectancy in our setting is maybe more than 70%, and that's going by published evidence. But in a first world setting, it's actually closer to 90%. And we, in fact, are trying to work to try and identify what are the factors that allow our patients, even with the earlier stage, to seem not to live as long. But yes, we'd like to have more for patients being diagnosed at the earlier stage.
Treatment usually involves surgery, radiotherapy, and/or chemotherapy. With your health report, I'm Shamala Pullen wishing you good health.